Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 homeopathic remedies for Otorrhea. What is Otorrhea? Otorrhea is a medical term meaning a discharge from ears. Discharge for ears. It is also called watery or runny ears. Commonly, it is the result of a ruptured eardrum from an ear infection. Otitis externa, or most commonly otitis media, is the root cause. In most cases, in maximum case, suffers otitis media suffering comes from Otorrhea comes from otitis media, that is middle ear infection. Middle ear infection. What are types of Otorrhea? There are 5 types. Purulent Otorrhea containing pus, Serous Otorrhea containing serum, bloody Otorrhea containing blood, Mucoid Otorrhea containing mucus, and clear Otorrhea containing water. These are the 5 types. Now look at this picture of anatomy of ear. This is very much important if you want to know deeply how Otorrhea is formed, why it is formed actually. Now this green portion is the external ear. This portion, that color I am not telling, this is I am just showing the area. This is the middle ear, and this portion is the internal ear. Internal ear, middle ear, and external ear. In this middle ear portion, there are 3 small bones: malleus, incus, stapes. Malleus is attached to eardrum, and stapes is attached to this internal ear structure. And this is a tube-like structure. This is called auditory canal. It is attached to throat. It is attached to throat. What are the common signs and symptoms of Otorrhea? Discharge from ear, ear pain, itching, ringing. This ringing is technically called tinnitus. Tinnitus. Fever, hearing loss, vertigo, redness of skin around the ear. How can Otorrhea be prevented? Wearing specialized earplugs during bath. This is an example, a photograph or rather picture of earplug available in the market. You can purchase it and use it during bath. Placing a coated cotton ball in petroleum jelly in ear canal. Another technique to prevent entering of water in the canal. When to see a doctor in case of Otorrhea? In case of an Otorrhea, consult a doctor immediately, because a lot of intratemporal or intracranial complication may come up due to complex arrangement of structure in and around the middle ear. Actually, Otorrhea started from middle ear. So since the middle ear structure is very critical position, so they can create a lot of troubles, that is intertemporal or intracranial. What are the trouble? A few trouble I have mentioned. There are actually 25 in the list. It is not possible to give all the things, so I have given a main important things. Hearing loss, this complication. Tympanic membrane perforation. You have an idea, tympanic membrane perforation. Cholesteatoma, it's some sort of accumulation of abnormal cells in the ear canal. Mastoiditis. Tympanosclerosis, that is sclerosis means destruction of tympanic membrane. Meningitis, brain abscess, subdural empyema. Subdural means below the dura mater. Dura mater is the layer of brain. Below that layer, accumulation of pus, empyema, inflammatory pus. There are so many other complex type of diseases also that I have not given, but not too much. You just knowing the name and words. That's why I have avoided. But mind it, otorrhea is a very difficult thing. I mean, very complex thing, rather difficult, complex, which can attack so many other diseases, and it should be attended immediately. That is the most important approach to otorrhea. Discussion about treatment with homeopathic remedies. Mark Shaw for otorrhea. Discharge of thick fetid pus and blood from ears after smallpox. Generally after smallpox, but it may not be always smallpox. Without smallpox, you can also give Maxol if the totality of the patient, the totality of the picture of the patient, total case matches with that of the patient, with that of this Maxol appearance. What is it? This is a thick fetid pus of blood. Gland around ears swollen and painful. Patients travel worse in warm room. Used to take glassful of water frequently. This is a picture of Maxol. You have to give Maxol 6 2 hourly. These are all acute cases. These are all acute cases, no chronic cases. Pulsadilla for otorrhea. Discharge like thin water. No fetid smell. Affection comes after measles generally or otitis, inflammation of the ear. Patients are very sober, soft, gentle, thirstless. This is a character of Pulsadilla. You have to give 6 Pulsadilla 6 3 hourly. Hypersal for otorrhea. Very much sensitive to touch. Patients crave for sour and pungent things, warmth, wheezing and throbbing in the ears. You have to give Hypersal 30 every 3 hours. Silicea for otorrhea. Roaring in ears, thin bloody pus. Patients very chilly. Give Silicea 200 3 days consecutively, and that will cure the case. Oramate for otorrhea. Very fetid pus with pain in ears. Patient despondent, thorough disgust for life, contemplating suicide. This is the general picture of Oramate patient. Oramate patient are very depressive. They thought of suicide. They have disgust for life. You give Oramate 6 4 hourly. Sorinam for otorrhea. Very much fetid, thin discharge. Patient chilly, warmth hugging, body emanates fetid smell. Give Sorinam 30 8 hourly. Graphitis for otorrhea. Bloody, viscous, thin fetid pus. Patients suffer from digestive skin troubles alternately. They have deep furrows on forehead. This is a general picture of graphitis patient face. Graphitis patient faces deep furrows on the forehead. Give graphitis 30 8 hourly. Sulfur for otorrhea. Purulent offensive otorrhea. Well selected remedy proves useless. Problem returns again and again. Patients leave bed early in morning hurriedly to pass stool. Patient eat a lot, drinks little. Last 2 or 3 symptoms, general symptoms, and first a few symptoms are particular symptoms of the disease. And you give sulfur 30 4 hourly. Actually, sulfur, this symptoms from accepting this thing, this purulent offensive discharge. If you just scratch out this symptom, the other symptoms will be applicable in any diseases. In all diseases, you give sulfur. If this matches. Sulfur is such a thing, and homeopathy that is the beauty of homeopathy. Don't think that these word for word must be matching for case of sulfur. No, not that. Well selected remedy fails, proves useless, problems return again and again, patient leaves bed early in the morning, hurriedly to pass stool, eat a lot, drink a little. This is a picture of the patient, not any particular problem.